Honorable, what do you know about WASUM? Have you heard of WASUM, the existence of the network that is made up of these sub-regional countries?
Well, I know much about Waho.
Okay.
But I haven't heard much about the WASUM.
Good.
Yes.
The WASUM, as I told you, is the West Africa, the health workers within West Africa, the unions,
yes,
have come together to form this network across the sub-region.
That's a very, very important and nice step that people have taken.
Good.
Because, you know, there is some strength in numbers. And if we are going to be able to extend quality healthcare service, we need well-trained health personnel. Then we come back with resources to make sure that we are able to reach our people. And so we realize that we have to train more qualified personnel, because if you want to go to the local level, you need trained people to a certain extent to extend the quality service, quality healthcare services. Majority of the people are living in the districts and the villages. What the training we have given a lot of our personnel now in West Africa are most of them are living in the metropolitan areas, big towns. A lot of the doctors and nurses, the qualified ones, are living in the big towns. And so it's leaving a lot of the people in the rural areas without health personnel. So the training and the association you have formed is very useful. We have to back it up with resources, because some of the drugs, some of the facilities, personal protective clothing and other things cost money. And that is why we're saying that the ECOWAS Commission came out with the fact that every person should spend about 15% of your national budget, of our national budgets, on health, because of that, to make sure that we harmonize our activities and pay attention to the health sector, which is a very crucial sector. If we want to catch up with the rest of the world, we have to train strong people. And you cannot have strong people who don't have access to quality healthcare services. And so what you are doing is very useful.
We are very happy you are also with us, and then you have mentioned this scaling up of national budgetary allocation to the 15%,
yes,
in line with the Abuja Declaration, as being also carried out by Waho. Can you make a commitment to this particular policy as a ministry?
Yes, it's something from the ECOWAS Commission. Ghana is a member of ECOWAS. The chairman of ECOWAS right now is our president, His Excellency John Dramani Mahama. And so he's spearheading and pushing other African countries to make sure that budgetary allocations to the health sector is scaled up to the 15%. So we are making every effort in Ghana to do likewise, to scale up our budgetary allocation to the health sector, such that we can meet up the 15%. So you realize that for the past 1-2 years, once he became president, we are building more health institutions, training more health personnel, and trying to expand, to build more CHIPS compounds at the local level, getting equipment, state-of-the-art equipment for most of the hospitals, replacing the old equipment to make sure that you can extend quality healthcare services to our people. So the 15% is our target. Definitely we are going to, being the chairman of ECOWAS, he's in the lead, making sure that we get to that point.
Thank you very much, Honorable.
Yes, thank you.
God bless you for coming.
Thank you so much.